now. All right, the page is refreshing. All right, so hello everyone. Thank you so much for joining us. My name is Gustavo Molina and I'm the Mental Health Literacy Specialist for Mental Health America of Greater Houston. Thank you so much for joining us, and I'll be the moderator for the panel on this immigrant refugee mental health. Today we'll hear from community members about refugee and immigrant mental health and how that looks like for here in the Greater Houston community, but as well as overall in the nation, in the US. And then we do have some questions prepared, but always feel free to ask those questions. We encourage you to participate. So please ask your questions in the Facebook comments and we'll do our best to answer them out loud or to go back and answer them later. So we have great panelists with us today. And so panelists, could you introduce yourselves, your role and organization, and let us know how you are doing? Sarah, could you start first?
My name is Sarah Howell. I am the social worker at Las Americas Newcomer School. I coordinate social services at Houston Revision, and I'm the founder of Star Counseling and Consultation. And my expertise is forced migrants. So I work with, I guess, especially kiddos right now who have had to leave their country and have just arrived in the United States. And so I look at a whole bunch of trauma and how that intersects with everything else, and acknowledging that pre-existing mental health, still happens in the midst of stuff that goes on. Is that everything you asked? Anything else?
Yes, thank you, Sarah. Sarwa, could you introduce yourself?
Sure. Hi, my name is Sarwa Newman, and I'm the Arabic speaker outreach specialist with Hope Clinic. Before that, I worked with the YMCA International Services with the refugees. And myself, I am a SIV, which is a special immigration visa. I worked with the American troops in Iraq for 9 years, and then I came to the United States 6.5 years ago. So basically, I know, like I work with the refugees and the immigrants in 2 stages. The first was with the YMCA International, so we receive them. And the second, when I'm working here with Hope Clinic, basically most of our clients are immigrants and refugees. So, and I'm helping the behavioral health clinic here in, more understanding the refugees and the mentality of and the backgrounds of those coming from overseas. Yeah, so hopefully I answered your question too.
That's awesome. Thank you, Sarwa. Paola, can you introduce yourself?
Sure thing. Good morning, y'all. My name is Paola Guzman, and I am the recently promoted, I guess, social services director over at the Houston Immigration Legal Services Collaborative. I do a lot of the work that falls under the access to services bucket as we've sort of expanded the work to fit more in line with holistic lawyering and looking at how we can look at the whole person. And so our collaborative works with the partnership of all the member organizations in the Houston area that do some sort of work with immigrants, refugees. So whoever our partners touch, basically we do. Originally from Los Angeles, I've been here for 3 years now. Previously, I worked with kids in need of defense as their social services coordinator. And before that, I worked at Pathways Community School, which was a school in South Central Los Angeles that had a lot of just like stuff coming up, right? A lot of trauma, a lot of newcomers, a lot of first gen going to college, but also a lot of kiddos who family members were incarcerated. And so just a wide net of people. As far as how I'm doing today, I am enjoying the rain inside the house. So this is working out. So I am doing good.
Good, I'm glad you're doing well. Thank you so much. Talia, can you introduce yourself?
Sure, thank you. Hi everyone, my name is Celia Warner and I am a licensed clinical social worker. I am currently a mental health consultant for HILS, Houston Immigration Legal Services Collaborative. I'm really happy to be here talking about this very important topic today. As I mentioned, I provide consultation services for HILS around mental health, and I also oversee their forensic evaluations program, which is a program specifically geared towards connecting mental health professionals with lawyers who are supporting immigrants in their asylum cases. I've also worn different hats in providing services to the immigrant community over the last few years. I provided counseling to people in the immigrant community and also case management services. So I've been doing this for a few years, and I definitely understand and value the importance of having these conversations. So I'm excited to be here today.
That's awesome. Thank you so much for joining us, Thalia. And last but not least, Sam, can you introduce yourself?
Hi, everyone. My name is Sam Cervantes. I was born in Mexico, and at the age of 5, I came to the United States with my family. So I'm a dreamer. I'm originally from Houston, Texas. I've lived in the United States for 17 years, and this is my home. And I hope today I can shed some light into the experiences that undocumented people are experiencing right now during the pandemic, during what the rise that we're seeing to protect Black lives and how that is affecting our mental health. I also wear a different hat. I'm also a research associate at Forward.us, an advocacy organization that works on immigration reform. As a DACA recipient, I work day in and day out to protect the undocumented community at the federal level, and I'm a research associate there, and my specialty is in state level legislation. So a very nerdy job in which I get to read laws and do analysis every single day, but I love it, and I hope today to shed some light into my experience as an undocumented person in the United States.
Thanks so much for those introductions, y'all. So like I said, everyone, we do have a few questions prepared around the experiences of working with or firsthand experiences of being an immigrant or a refugee. However, we want to hear what questions you have. So if you do have questions, we'll make our best effort to answer them out loud. But to start off with one of our prepared questions, for everyone, why is it important to talk about mental health in this community? I know that oftentimes immigrants, refugees, and asylum seekers, right, have a lot going on, often being persecuted by police, ICE, and other agencies. And always or seem to be living in limbo, right, of not being from there, not being from here, and not necessarily having a permanent home. So sometimes mental health can go to the back burner per se, but why is it important to, from your perspective, to talk about mental health? Sarah, go for it. I see you trying to say something.
I like silence, even as a therapist. Mental health is integral to everything. I mean, it impacts how you function. You don't function as a whole, as complete of a successfully integrated whole person if your mental health isn't addressed. And so just this idea that, I mean, I know we see more and more that mental health is as important as physical health, but I think that with the immigrant and refugee communities, it's not always being addressed, and it's not always addressed appropriately. And so there's talking about it, there's breaking this or like reducing the stigma around it, but then there's also making sure that we're providing appropriate services and approaching it in an appropriate way. And on top of that, I think that the immigrant experience, regardless of whether I'm looking at the forced migrant population or a community that's grown up maybe a second generation, it affects our immigrant community different than it affects like the community that I represent, like this white, Caucasian community, access to resources, all of it. And so I think it's exceptionally important because it's impacting every part of life, of anxiety around access, just everything. It's part of everything.
I think you sort of touched on this a little, Sarah and Gustavo, right? Like whenever we are sick, right? Like whenever we have some sort of physical ailment, we go to the doctor, no questions asked, right? Like there, and even then there's some issues of access and like issues of like whether or not I trust the doctor or whatnot. But if you have like a cut, like you go to the doctor or a nurse or whoever, and they sort of heal you up. And those sort of elements of the spirit and of the mind, we don't do the same sort of like connectedness to, right? And most people will go to like religious practices or spiritual practices, which is completely fine, and great, right? Because that's support for the spirit, but not a lot of people consider support for the mind. And if we're looking at people as like in a holistic way, right? Like we're looking at them as mind, body, soul, we need to make sure that all components of a person are okay so that they can be okay, just flatline okay, right? We also need to remember that like experiences of trauma and experiences of mental health can be passed on, right? And we know this through epigenetics, and we know that like trauma can be caught from mother to child. We know this, right? There is science around that. And so if we're not sort of dismantling pieces of what that looks like early on, then these are things that just lead further down to heavier, diagnosis of mental health issues, right? So you mentioned that there's so much uncertainty right now. Well, there's like the immigrant population is experiencing basically the carpet constantly being pulled from under their feet, right? We have public charge, we have executive orders, we have bans, travel bans that have occurred, we have COVID, right? Like there's just all of these things that are occurring. There's no stable footing. And so if you're living your life in constant fear, constant anxiety, constant concern, like that in itself turns into mental health problems that are then not, like Sarah mentioned, are not then being addressed, right? And so they just become worse, or they get to like heavier diagnoses. And so it becomes incredibly important for us to address those things.
And to add to that, I think it's really important that we talk about mental health in our community, so we remove the stigma of talking about simply mental health in immigrant communities. And I'll talk in particular about my Latinx experience. And also that we start highlighting the pure lack of resources that a lot of immigrants do not have access to. And it's particularly worse for undocumented immigrants. I, someone who is undocumented, lived my whole life in the United States without the conscience of citizenship until I got to high school and had to apply to college. That's when I really started to realize, wow, I am really different than my peers. And these were a lot of things that I never felt comfortable talking to with my friends. Only a small number of people knew about it. And now looking inward, that sort of boxing or containing of feelings can very much damage the way that you perceive yourself in the outside. So it affects your confidence levels, it affects your happiness levels, it affects your energy. And the immigrant community is very much tied into the idea of the American dream. My parents came to this country with the idea, if you work really, really hard, you're going to achieve. But work really, really hard, don't stop, because you don't have time to think about what things you need to work on. And very much often the immigrant community, talking from the Latinx perspective, doesn't talk about mental health because of the stigma of seeing it as a form of sickness, because it is bad to talk about to your mind. And I think, Paola, the way you described it is very true. If you get a cut in your finger, you go to the doctor. In the same way as someone who, me in my situation where I had feelings of like, why am I doubting my skills? Why am I feeling sad when things are going well? And when I went to talk to my psychologist, my counselor, it was just conversations of like really tapping into the feelings that are not allowing you to progress. And unfortunately, with things like public charge and, which affects the ability of immigrants having access to resources with the fear of not becoming a citizen, that is very fearful. The idea of you never becoming a citizen, there's some people that wait in this country for 10, 15, 20 years, and public rules like that make it even impossible. But now I'm going to the policy side. You got me started there. But we need to talk about the lack of resources. Sometimes in order to see a psychologist or get mental health access, you have to have insurance. That's something that undocumented immigrants do not have access to. Insurance and access to healthcare in this country is tied to employment. And if undocumented immigrants cannot have access to legally work, then they don't have access to the resources. So I think it's really important to destigmatize the conversation around mental health and also have a really clear and bold ask to make resources ubiquitous, available for everyone, regardless of their employment status.
Also, if I may expand on that, absolutely agree. I think that two of the major issues, one, access to services, and two, the stigma. But sort of expanding on that a little bit too, from a mental health perspective, is the idea that prioritizing your mental health, it should not happen when you're having difficulty meeting those basic needs, right? We know from Maslow's hierarchy of needs that we do what we have to do in order to have food and shelter for our families, for ourselves, for children. And so what often we see happening in our immigrant communities is that we have to prioritize those things over mental health. And so there's also this stigma around, well, I'm going to the counselor, but I don't have the funds for this or that, so we have to prioritize. And so it becomes really important to say, if it's important to go to the doctor for a physical ailment, it is also very important to go to mental health support for ailments of your mind. And so that's part of the job that we have, is destigmatizing what it means to reach out for mental health support. And so with the understanding too, that even though somebody can seem like they're doing okay, everything seems okay, sometimes we may not be living with full psychological functioning. We may not be living an expansive life because we're just limiting ourselves to being able to obtain those basic needs and not prioritizing mental health, because sometimes that's all we can do. And so it's important to understand that the stigma also is around that, and how to work through
that. I want to add something else to the conversation here. We're talking about the undocumented immigrants and other, like the asylums and others. So, but from my experience, we have another category, which is the immigrants are the ones that came from the overseas. When we talk about those, I meant the people who came from the war zones, like Afghanistan, Iraq, Syria, Sudan, some countries in Africa, others from the Far Asia. Those are actually, they come here with a big trauma because of the war, because of what they saw, because they, a lot of them, they stayed in refugee camps for years. I saw people stayed in camps for 10, 12 years, waiting for the papers to let them, leave these camps and come to the United States or other countries that can, take them as refugees. So when they come here, there's a lot of things, like the education, the even the health. They're not able to do a lot of stuff. So health wise, mental wise, sometimes even physical wise. So we have to address these things, from the beginning when we receive their papers, because once they got here, all they have to do is they will think again, I'm in a new world. This is, everything is new for me. How can I blend in with the community? I have to make a living. I have to find a job. I have to support the family. It's a lot of stuff that they living here. We adding a lot of stuff to their thinking. It's not, and then it's the trauma they came with, it's still there. It's not been fixed. So let me tell you something. One day I was talking to the director of the behavioral health here, and we were talking about the immigrants, and and then I mentioned something. I told him I lived here for maybe 4 years until I start, every time I hear the thunderstorm or the thunder, I I just woke up from my sleep, and it's triggered the sound of a bomb car or an explosion or whatever. And this actually, like he didn't know. He said, really, I didn't understand this because like a lot of immigrants um, said the same thing. Like the thunderstorm is like I get afraid from the sound of the thunder. He didn't know why. When I talked to him, how I link it with the sounds that my mind used to, it's stored there. It's still there. Like every time I hear something, it's always like it's a bomb car or it's an explosion. So we need to know all the like the things that they went through, so we can prepare them to be healthy, and to be can make the living here and can be citizens that we want them to be. Not bad way, I mean healthy wise citizen. I don't know, maybe I didn't like sometimes like when I get the memories, I be excited, or I don't know, it's make me confused, but hopefully like I get the idea well, like explain it in a good way.
Well, thank you everyone for sharing those perspectives and those narratives around why it's important, right? I think one of the questions I did have was, what are some of the barriers? But I think those were covered here. There's stigma, right? Because of the stigma in other cultures, right? Sam, you talked about the stigma within the Latinx, Latino community. Some access to care, right, is a huge stigma, and who is able to access. I guess the question, so in relation to barriers, but as well as with current events. So I'm curious as to asking y'all, how do immigrants, refugees, and those that support them, how do people kind of continue to cope with and sit with current events in relation to COVID, racial and civil unrest, right? All the events that are going on. Especially and also with different executive orders around F1 visas and DACA decisions by the Supreme Court. How do we all deal with this, right? Whether it's from the immigrant refugee perspective, or those that support, or even those in the mental health from the mental health field.
Like I can go ahead and jump in here. I think the first thing is you sort of just like let your emotions be your emotions, right? Like if you're angry and it makes you upset, that's okay. Like sit with that for a minute, because I know that this administration has there's a saying in Spanish, me ha sacado las canas verdes, which is basically is giving me, instead of white hair, green hair. So it's okay, like that if that is what's going on and what's happening. I think there are like just a wealth of sort of readings out there, right? Like if people are like in the moment of like, I don't know what to do with this anger, like there's a sort of a bunch of sort of resources and readings that people can do, whether it's in regards to Black Lives Matter or Immigrant Justice. I think our organization is sort of trying to really focus on this idea that like justice is justice, right? And I think we like to sort of break things into boxes because that's what we're comfortable with, right? Like we like to sort of say like I can look at a woman, just a woman, like the gender role issues. I can look at a woman who is transgender and just like the transgender issues, right? Like the sort of boxing people into things. And we need to sort of step away from doing that and start looking at how this is all connected, right? How injustice is all sort of connected. Immigration law is racist, right? Like fundamentally, it is racist. It keeps out a huge chunk of people because there is a fear of a browning of America. And sorry to tell you this, but it is too late. America is brown, get over it, right? Like, and so there are organizations that are trying to do the work of like advocacy, to do the work of like working together and sort of fighting against administration. There's only so much that we can do. And I recognize that there are all the people that work in those organizations are doing the best that they can and are also needing of like mental health support, right? Because they're constantly getting received with no's. I'm not sure if everyone is familiar with like the denial rate here in Houston for asylum, but it is very high. So if we're like at, for example, I like to use this comparison in California, let's say it's 84% approval rate, that's the denial rate here in Houston, right? So we have a lot of attorneys and paralegals and people working in the legal sphere that are constantly being hit with no's and just like hearing, the secondary trauma, the vicarious trauma, and like making sure that like HILSC is trying to do work around how they take care of themselves so that they can continue doing the work that they're doing, right? Working in collaboration. So I don't want to like continue to plug HILSC, but like a lot of the work that we do is in collaboration. So bringing in organizations that are the experts and sort of saying like, how can we work together to tackle this issue? There's big sort of advocacy groups here in Houston, like Houston Leads, Right to Justice, that bring people to the table to do a lot of local level advocacy, and people can sort of plug in if that's something that they're interested in doing. But it's like, there's a lot of things that are happening with the administration that are going to continue to happen. So again, the first step is always like feel what you got to feel and like get yourself to a good sort of emotional place. And if you're called to do advocacy, go ahead and join one of those organizations or join those advocacy groups. And if you are more of an introvert, that's okay. There are other forms of advocacy, right? You can donate, you can do some reading, you can around your social circles sort of say like, hey, this is the stuff that's going on, and try to change people's minds, recognizing that you might not change it, but you can plant a seed, right? And so there's actionable things that you can do, because I think a lot of the times we sort of feel stuck and get stuck in that stuckness, right? And so those are just sort of things to charge the batteries.
Thank you, Paola. Anyone else would like to answer that question?
Yeah, I just been thinking about the way I've been feeling this last few years, and I think it's easy to articulate that since President Trump got to office, it's been really, really stressful. Fear has been like a good word to describe what I feel. I think anxiety is another good one. And I think when we think of the undocumented community, there is just this constant fear that when you open the door, you may not come back. And it's this fear, and I think you can point at the way that coronavirus occurs, and it's a completely different experience. Like when you see your family member go out to the hospital and you may not know if they come back. And for me is an agonizing fear of knowing that if my parents leave the home, would I be able to see them? What were the last words that I told them? Are they going to be safe? And let's not even start talking about the horrible conditions in ICE detention centers that in and of themselves should be abolished. And when thinking that over the last 3.5 years, we've been under a cloud of executive orders, proclamations, a lot of states were emboldened to pass anti-sanctuary legislation that basically gives the police the ability to contact ICE. And when you think of like all these state level entities that can easily separate your life. We saw this at the border. We were going to see family separations inside of the United States for many people that have lived here for more than 20 years. It is really fearful. And I think the pandemic, the brutality against Black lives, I think of my peers who are Black and documented immigrants, the plight that they're going through, what they're going through. And I don't have an answer as to how to fix this. I just wanted to provide context of what people are feeling, not just undocumented people are being attacked. And I think it's incorrect for us to walk the day and think that only undocumented immigrants are the ones being attacked. Legal immigrants are being attacked left and right. Like a new report came out that our immigration is going to be cut down by 50% next year. That's going to hurt our economic boom. It's going to hurt families. It's going to, like, many of these people are waiting to see their loved ones. And I think what we can do as allies and as immigrants is check in on each other. It's basically, how are you doing? How are things doing? I think for me, since DACA was terminated in 2017, for me as a resource to be able to work, provide for myself, and being the lowest priority of deportation, when that was ended, and when I knew that the Supreme Court was going to give a decision, every Monday for 2 months, I would wake up in the mornings, log in, and wait for the Supreme Court to give a decision. Like, I'm always told to pull myself on my bootstraps and do it on your own, but this time someone else had control over my life, over my own agency. And I remember my friends just simply checking up with me and saying like, hey, it's going to be fine. It's going to be fine. And sometimes you need to hear those reaffirming words from your loved ones and from your friends. And you never know whose day you're going to change simply by saying, I'm here for you. I see you, I acknowledge you, and I love you. And I think kindness and respect are a really good way of promoting love, especially during these very, very difficult times.
So listening to you guys made me think of this quote or this post that one of my kiddos had made. This is from a boy who has given me permission to share it. He's from Sudan. He had come at the tail end of the wave of the Lost Boys of Sudan, and he graduated about 2 or 3 years ago. He's working as a model now, but he wrote right after George Floyd on Instagram, "It seems like my entire life I'm just constantly running from something. If it's not war, it's poverty. And when you think it's over and you're in a better place, hate in that place, it makes you just want to go back home." And then he followed up saying, where can I be a human in peace? Where can I live without being led? Where can I be Black and unbothered? And to hear a young man who had fled Sudan share this, it hit harder than some things. And listening to each of you, one of the things that really jumped out was, I think that unfortunately in the immigrant community, fellow immigrants, often parents, have normalized the trauma and the terrible things that people have experienced. I'll never forget listening to a Congolese mother. Her son, they had been here about 2 years. Her son was really struggling with addiction, with really intense substance use. And she looked at me and she was like, but I was the one who fled the war. He was just born in the camp. I was the one who was raped. He wasn't. And there was this complete disconnect. I see it all the time with my kids who've arrived from Central America, and the parents do not honor the toll that the gang violence takes on them. All they see is like, but that's just part of our life. That's part of, it's ingrained in who we are. And as a cultural outsider, that's bullshit. It's not. That is not true. As a clinician, and we know how much these things impact, but unfortunately they've become such commonplace. I think that we are not honoring the toll that each traumatic instance and how each of these upsetting instances are actually traumatic. And then like we've all talked about, like the toll it takes on mental health and then the impact of accessing help for it. But we just don't see, it's just become too commonplace. It's been normalized.
Definitely. Thank you all for sharing those. We do have a question from Facebook. Lauren asked or said, thank you for talking about trauma. How do we talk about trauma in this community and help others process? Some of you were talking about those things. So I'll expand the question out, right? For those that are not immigrants or refugees, how do we serve as allies to this broad community to help with that trauma, to process and to normalize talking about mental health for the community?
I think one of the important things when working really for anybody is to have a good solid foundation and good solid understanding about what trauma is, right? You often have this, what is trauma? Is it the response or is it the experience, right? And so really understanding that question at its core is really important. When you're looking at someone through a mental health perspective, right, you're focusing on not so much the experience, or not so much the experience of the traumatic situation, but rather like what was the outcome for that person? Because two people can experience the same thing, and yet one can have PTSD or traumatic symptoms and the other not. So that's really important to understand, is that we're all different. We all have similar different experiences, but our personal reaction to those experiences may vary. And so something that is, really, unfortunately, really common is that when there is trauma, when there might be potentially complex and long-term trauma, it can manifest itself in ways that people tend to not understand. So, for example, in children, it could seem as behavioral issues, and a lot of them get misdiagnosed with ADD, with compulsive disorders, and things that really, at the end of the day, is really just stemming from trauma, oftentimes complex trauma. And so for anyone, for teachers, for not just mental health providers, for physicians, for teachers, anyone in the community, to really understand and have a solid understanding of what, when we say trauma, what that means. When we say trauma symptoms, what does that mean, right? Because what we're seeing is, like I said, it's just often misdiagnosed children or even adults, and it's not so much the behavioral stuff, it's the way that the trauma is manifesting itself. Oftentimes people don't know that trauma can even lead to psychosis, auditory hallucinations, visual hallucinations. That can sometimes be a symptom of trauma, of complex trauma. Immediately people go to other diagnoses like schizophrenia, and that's not always the case. And so when we as community providers have a good understanding, we are better able to support people that have experienced trauma, and not to immediately label someone with the wrong label and then multiple labels on top of that. So that's one thing that it's really important, is just to provide psychoeducation, not just to the client, not just to the immigrant community about what trauma is, but also to providers in all types of settings. It's really important, and I cannot emphasize that enough.
To piggyback on that, I think it's crucial to understand some basic knowledge of what's happening other places. You have to be aware of one of the things that makes me the maddest is when I hear somebody devalue or invalidate someone's experience because they just can't fathom that it could be that tough, that bad. So you don't need to be a cultural expert at every place, but you need to be culturally aware and know that these are the types of experiences that might be happening, and never tell you are not an investigator, you are not a police officer, you're not the judge, you are here to listen. I mean, if your goal is to be supportive, you're there to listen and accept them and their experience for how they present, because maybe it's through their interpretation, through their lens. But being aware on the scope of experiences that might be happening from Guatemala versus from Bhutan, from Iraq, just having some context of political events, and then with that of policy, of how, and just that open-minded empathy to how those can intertwine is so important. Of course, on top of the trauma knowledge as well.
And to sort of add to what you were saying, Sarah, because Sarah and I have sort of talked about this a bit, is like having a cultural context for like the language that's being used around trauma and the explanation of trauma, right? So like one of the examples that we sort of were talking about was like un susto, right? Like, which is in Spanish, a susto is like something that scared you or something that like made you afraid, right? Which can be someone explaining a traumatic experience. And in my own like previous, back when I was in social work school, like that was one of the things that I would hear a lot of clients saying, was that the kid had un susto, or there was something that happened, right? And so really having an understanding of expressions, not just like connected to like what's going on in home country, but like how people are expressing themselves, and coming from a place of curiosity, right? Like what do you mean when you say a susto, or what do you mean when you're saying this thing, right? Because we're not the cultural experts, the people who we're working with are, and so it's really important for us to validate their experiences and seeing them as their own cultural expert.
Thanks, y'all. So moving on to a different question. Oftentimes, we are talking maybe about barriers and some of the deficits, right, in regards to mental health in the immigrant refugee community. But I wanted to also talk about the strengths in the community, right, because this community does have a lot of strengths, right, in how they came to this country and are facing barrier after barrier, or don't have access to services, and still keep going forward, or have that mentality of moving forward. I think, Sam, you talked about this a little bit, but so what are some of those strengths in the immigrant and refugee community that helps with mental health of the immigrant refugee community?
I think the clinics like Hope Clinic, linked with the agencies and entities that works with the immigrants. It helps a lot. Build the trust with them. Because most of them they come here with the mentality of like I cannot go and see a psychiatrist. It's a shame. They will call me like crazy. A lot of countries back from like they still have this mentality, but having such clinics, with like Legacy, Hope. There is also with Alliance for here in Texas. I mean in Houston. Also, they provide mental health um, um, services. It's make it more easier for them. It's accessible. It's sometimes it's for free. They can talk even with the case managers, and like step by step the case manager can convince them to go and see a provider, or like a therapist or a psychiatrist. So I think with kind of like these communication, or with these links between the clinics and the entities, we can reach out more to the community, and build a trust with like in getting the services. This is how we see it.
So, you can go ahead if you want.
Oh, thanks, Sarah. I was actually just going to talk about a point that you brought up. I think Sarah was talking about some immigrant communities just sort of accept and say this is the way life is. It is what it is. You can't really change it. I've heard that from my parents a lot, and I think very much someone who grew up in the United States, I have a different perception of what change is. I've been really blessed to have had access to an education which really taught me about history, about the civil rights movement, about the origin of our country, and like the venues of change. And when I compare that to what my parents think, like, oh, it is what it is, they themselves are creating change even if they don't know it, because it's the resilience and it's this just activation of perseverance that I've seen not only from my family members but the whole broad community overall. It's like we lack access to many resources. And oftentimes I remember when I'm growing up and I would say, I don't have access to that. And mom would say, well, we got to find a way. You have to find a way, right? And it's putting in more time in research and, going online, going to webinars like these, tapping into organizations like the ones that are represented today that have really changed my life. And, I'm pointing back to my mother because she's the one that I always look up to, is as someone who had limited English proficiency, as someone who was still trying to learn all what the United States is, and even as adults, even as someone who's been in this country for my whole life, things are very confusing. Insurance are very confusing. Paying rent sometimes can be really confusing. And I'm really astonished to the way they persevered and having to understand it and hustle. So for me, it's like the really good things that come out of our community is perseverance, integrity, and our hustle spirit to always find a way, and that eternal positivity of we're here to start something new, and it's not just about you. And that's something my parents have always agreed. It's not about you, it's about the generations to come. And I think that sort of mentality allows us to, even in dark times, find positivity and find growth.
This is consistently my favorite question because I instantly know my answer. My immigrant refugee families are hard as all get out. Like, they are tough, they are strong, they are brave, they have fought hard to get here. And it is the easiest group in there. It's the reason I choose to do mental health work with them, because I pull on their strengths. I believe in a strengths-based approach. And we talk about, look at what you've overcome. You've already proven you're a fighter. You've already proven how brave you are. Let's just keep it up. Let's look at all of the, I was making a list with kids recently about what you've already accomplished. You made it to the United States. It's not just you get up every morning, it's that you crossed borders to keep yourself alive. And so it is just it's a concrete opportunity to prove their resilience to them. And they don't so often my kids, my families don't see that. Like, you fought hard and you can keep fighting, but you've already proven you're capable of it. So incredibly resilient, incredibly brave, incredibly perseverance.
And to piggyback off of that, I think, you know, one thing that I've seen that's unfortunate in the community sometimes is that as providers, we sometimes infantilize our clients and like, oh, let me do this for you and here and here and do you need me to do? No, I mean, I think, you know, what Sarah mentioned about taking a strengths perspective approach is so important because you're seeing the client as someone who is resilient, someone who has done so much to get here and continues every day to fight the battle to keep moving forward. And so it's really important for providers to know that we're not here in I'm going to do this for you format. It's let's look at what you've done and let's keep moving forward with that strength that you already have. It's really important. So, you know, I sometimes see like in our effort to like support people, we forget about that empowerment piece. And it's always about the empowerment and looking at things through a strength-based perspective. It's emphasizing the resilience and the perseverance to be here. And Sam, you mentioned things that like really touched my heart because I too was once a DACA recipient. And, you know, thinking and looking back, like sometimes my mom will tell me like, I'm so proud of you, everything you've achieved. And I'm like, you know what? All of these things, Mom, I got from you. I got from you and from Dad. And yeah, like I have my degree, but you know what? That was part of your like how resilient you taught me to be in the face of adversity. And so we talk about intergenerational trauma, but what about intergenerational resilience, right? Like we see that time and time again in the immigrant community, and so important as providers to remember that.
And I think that like you see that also in just like I think that this is sort of my with the mental health sort of work is that like we don't see these informal support systems as like on the same level as like going to therapy. Let me give you a concrete example, right? So like there are, for example, a group of women that get together every, you know, Tuesday morning to get some cafecito and some sweet bread. And like, they just like gossip about what's been going in the neighborhood, right? Like that's a support group, right? And so, and that happens informally in a lot of like Latinx cultures and a lot of, not just Latinx cultures, right? Like in a lot of collective cultures in general. It's this idea that like, if I'm good, you're good, we're all good, right? We're gonna lift each other up. And I think that you know, the US is a very sort of like individualistic culture, right? Where it's like, I'm getting myself up, I'm moving myself forward. And like when we look at other cultures outside of that, it focuses on how do we lift up, right? Like what you were saying, Samuel, like how do we lift up the next generation? How do we continue to lift ourselves up and get to a better place, right? Like I am going to sacrifice so that you get to a better place, but that sacrifice doesn't come at a cost to you, right? It comes as a cost to me so that you can keep moving forward. And like, even though there was, for example, financially in my family, we had a lack of resources, that's okay, because so-and-so down the street has chiles and we can get them from there. We have some lemons and we'll give them the lemons and so there's these informal sort of like systems of support that exist, right? Like my dad has the brown dad power where I can literally call him and say, Dad, I have a flat tire. What do I do? Don't worry, drive the car down this way. I have a friend who works at the shop and tell him that I sent you and he'll fix it for you and then send you to the next person, right? Like that is the beauty of coming from collective cultures, is that there's such an interconnectedness, there's such a support, there's such a compassion for each other that like these informal systems of support really propel us forward, right? And it's connected to our resiliency, it's connected to our next generation being better than the one before.
That's really great, y'all. Yeah, I definitely thank you, Thalia, for bringing that up, right? We often talk about trauma or those barriers and look at it from a deficit standpoint, but we have to look at it from a strengths perspective and truly empower folks, right? because at the end of the day, we know more about ourselves than anyone else will ever know, right? And so it's important that we stay together and that we, we practice our cultural values. So one of my last questions, or my last question really is, what message of hope, or kind of what the next steps you would say after this conversation, right? How do we continue these conversations? What messages of hope do you want to send to the immigrant refugee community?
I mean, I would say it's really hard, and I think it's okay to acknowledge things that it's really hard, that it's painful. Not every day is going to be a good day, in the sense of like what the news may come and tell you, and especially in our political environment under the pandemic, and and I talk about it yet again, protecting our Black brothers and sisters in the Black community. But we will persevere. We've done it in the past. We've beat many multiple things, and history has taught us. So I would say in the days where you feel sad, find some tranquility. If it's coloring, if it's going outside. My dad's the kind of person that's working on the yard all the time, and I know that for him is his way of finding tranquility. And I let him do it. Sometimes he makes me go help him out. But yeah, like when the days are hard, just tap into those networks, tap into your family, tap into your friends, and we'll persevere. We've always have.
I would say, we talked about earlier about how the immigrant community tends to prioritize, basic needs, which absolutely makes sense. But I would like to, just sort of encourage people to view mental health almost as like as breathing, as eating, because it's so important. Because we sometimes see people and they seem fine, everything looks okay, but inside there might be just turmoil, and you just can't see that, and they're not living again with full psychological functioning or just expansively. And so part of having strong communities and strong families is to have that strong foundation of mental health. And so, what I would say is to encourage everybody to place mental health to prioritize it, because you have that understanding that if you're doing well, you're helping others do well too. And if you're deficient in anything in mental health, and you're not able to provide that support to others either. It's like that basic understanding of when you're in the airplane, what do you do with the oxygen? You place it on yourself first and then your child. It seems selfish, I know it does, because your first go-to would be like, I want to protect my child. But in order to protect your child, you have to protect yourself, right? Like it's like basic 101 being on a plane. And if we can understand that, then we can understand that mental health is as essential as the air that you're breathing. You have to have it in order to be able to have a strong foundation for yourself and for others. And so making it a priority is not selfishness, it's actually the opposite of that.
So to immigrant refugee individuals out there, I would encourage, look for helpers. There are people who have chosen this as a field, all of us, to be your advocates, to be your allies, to be your support. So look for, and if the first helper doesn't fit, find another helper. Not everybody's is going to help in the way that you need. It doesn't necessarily mean enable, but support. So there are good, kind people out there who want to support. To the general community and helpers who are out there, this is your community. I mean, this is, I was reading a really good book about, it was about violence in Central America, and they're talking about why should you care? Because this is who you're surrounded by, because these are your fellow human beings. So, I mean, think about, again, golden rule, how you'd want to be treated, but also this is it. These are your neighbors. And so being empathetic and there's not this, we're moving away from this distinction of, an insulated community. So if you're going to seek services in the greater area, if you're going to you're going to be surrounded by immigrants. And so embrace it and get to know and learn about other people and what all of the learn about yourself and what you and they can both contribute and bring to the table.
I think one of the sort of messages, just to like add to what everyone has been saying, right? Because like everyone, you guys are hitting those nails on the head, is the reminder that like you as an immigrant, as a refugee, as just a person on this planet, you are worthy and you can say no and you can ask questions. And I think that like oftentimes we're so like people are afraid of authority. It's a real thing. People are afraid to ask questions because they don't want to, be in the limelight. They want to sort of stay in the shadows. And I fully recognize that. And I fully recognize how difficult it is to ask questions. And I fully recognize how difficult it is to see like the worthiness in self. But that is something that we need, right? Like if you are armed with with what your rights are and you know what, like you cannot do this, you cannot enter my home without this warrant, like use that to your advantage, right? If you go to a doctor and your doctor is telling you something that's not right and you know that's not right, like you have the right to speak up for yourself because you are worthy of that, right? And it is when you start doing that and you start sort of standing up for yourself that you can start breaking a lot of those chains that have been sort of that we have inherited, right? Whether it's because of colonialism or whatever sort of has put those chains on us, like we are the ones responsible for breaking them, and so you are worthy. That would be my message.
Sarwa, any messages of hope or any next steps that you would say to our audience?
Yeah, I want to say that they have, like as we said before, and acknowledge that they are brave, like to cross the borders or to come along this, like long way and make it to the United States. They have, like they have the strength to keep doing it, keep going on. And there's a lot of resources here in the community that can be, like under their in their reach, so they can reach out to these resources. Um, Providers, education, health, whatever they need, it's there. All they have to do is to ask the question, ask the right people, and from one to another, they will get what they need. Free resources. There is a decent resources. Insurance or without insurance, there is a lot, and like here, providers and clinics and education. I mean, they can do it. So, and we are here to help them in like getting all these services. So yeah, that's my message. So we're message of hope.
Well, thank you,
Yeah.
everyone. Thank you, everyone, for providing those messages of hope and providing your perspective and letting us know how you either contribute or continue to contribute to this important demographic, right? And what keeps running the country sometimes. So for everyone, we will post some resources, but of course, those that are coming from here, right, from the Houston Immigration Legal Services, the Hope Clinic, Las Americas, those are resources in the community or for the community. And there are tons of more, like Sarwa was saying, that offer free to low cost mental health services. And so, but at the end of the day, right, maybe my message of hope or maybe next steps is to, like some of everyone was saying, right, making sure that we listen to each other, and ensuring that we connect folks to others. And so that part of it is connecting folks to mental health services. So if anyone would like to more information or for other resources, you can visit our website at mhahouston.org, where we do have some resources for telehealth and other services. But thank you so much for visiting us, and hope you have a good day.